Refugee Camp, located in the northwestern region of Kenya in Turkana County, some 800 kilometers from Kenya's capital, Nairobi. Established in 1992 following the arrival of the lost boys of Sudan, it subsequently became a safe haven for people fleeing from other conflicts. Now it is home to over 196,000 refugees from 23 different nationalities. The refugees have not been spared by the coronavirus, and since the first case was reported in the country in mid-March, things at this camp have had to change, especially on the distribution process. As partners try to make them comfortable, they will also have to adhere to social distancing guidelines on COVID-19 prevention. Early May 2020, a 32-year-old immigrant tested positive for the novel coronavirus that causes COVID-19. The patient allegedly dodged several police roadblocks and traveled over 800 kilometers by road from Kakuma Refugee Camp to Nairobi and back. As coronavirus cases in Kenya rise by day, authorities here are taking precautionary measures to prevent further spread of the virus.
Upon the onset of COVID-19, we stopped or ceased movement, issuance of movement passes to other parts of Kenya to access services that are not available in the camp, education, legal, health and otherwise. So we ceased this on 10th of March.
Within the camp, humanitarian organizations have adjusted operations in response to the pandemic.
We have had to change the duration of distributions. We've had to change the infrastructure we used for distributions. For example, in the center we are today, we usually conduct distribution within 3 or 4 days and serve around 1,500 to 2,000 households in a day. But because of the adaptation to COVID-19 guidelines, we've had to adjust the number of people we serve to less than 1,000 people and conduct distribution quite a longer period of time. Instead of 3 or 4 days, we take 5 to 6 days to complete.
A population traumatized by violence is now terrified by the fast spreading disease. At the food distribution centers, health officials are teaching this vulnerable group about the importance of proper hygiene.
Our aim here is to ensure that the aspect of social distancing is really taken into consideration. You see that we have holding areas where beneficiaries could come and stay there, as they are directed or ushered or guided to specific locations. You'll find that once a beneficiary comes, lining up, there is body temperatures taken with our partners, that is IRC, and once after that, if at all the issues are not there, the person is forwarded to another holding area, then be directed to do hand washing. We have hand washing stations. We have also liquid soap, whereby you will see the beneficiaries washing their hands, thereafter directed to another waiting shed as they proceed to the verification to show this is the right beneficiary who is supposed to collect the food ration. Thereafter, the beneficiary is allowed to proceed with the food collection process.
20-year-old Abang Ochot, a South Sudan national, and her family found solace in Kakuma back in 2014. Just like everybody else, She is following the COVID-19 prevention protocol. Before receiving the family's food ration, she must attend a sensitization session.
Tawezaje kuweza kujikinga na ugonjwa huo? Ni kuoshea mikono yetu kila wakati pale tunapogusa uchafu kwa mikono na sabuni na maji safi. Vile vile tunakatazwa kusalimiana kwa mkono na vile vile kukumbatiana. Tunaambiwa kwamba tuweze kuzivaa barakoa zetu, face mask, kila wakati tunapotembea ndani ya community, aidha tunapokuwa barabarani, hakikisha kwamba umevaa barakoa yako. Vile vile epuka kukaa katika makundi ya watu, kwa sababu hatujue nani ambaye tayari ameshapata maambukizo hayo.
The only thing that have changed is like last time we would normally be given big food, now we are receiving food for 2 months. It is a bit challenge because now we can use the small food for this month, but the other coming month it is a problem. We can get our food is already finished, so and there is nowhere to get food. What I know is just only you can wear mask, and then you cannot stay where people are congested, and you stay only where there is few people.
In addition to enforcing sanitation guidelines from the Ministry of Health, isolation wards have been identified and extra beds installed in the refugee camp.
We have provided for the social distancing as you come through the triage, and should there be a case that the people are tried suspect would be able to meet the case, then they would be sent to this point where we have clinicians who are specializing in this. This is an 8-bed capacity, but we also have additional 2 beds for children. That brings it to 10.
Just like other areas in Turkana County and indeed the country, schools and community centers in Kakuma are closed and social and public gatherings are banned. Nevertheless, humanitarian agencies are appealing for support to continue providing clean water, soap, and sanitizers to the refugees in the camp. Purity Museo, Channel 1 News, at the Kakuma Refugee Camp, Turkana County.